So today's talk is brought to you by the letter C. And why do I say that? Because a lot of characteristics that make a good scrub tech start with the letter C. You must be conscientious. This is very important. People are not going to be watching your every move, but your sterile technique matters, and it's up to you to have that integrity. Be consistent. If you are consistent with the way that you set up your back table every morning, the way that you set up your Mayo stand, the same way for every case, then you always know where your blades are, where your post-op injections are. You'll be much safer and you'll be more efficient that way. And the other way to be consistent is when you're passing instruments to the surgeon. So if you haven't scrubbed at all before, then you'll need to think about how you pass instruments, and you'll want to be really consistent because they're concentrating on surgery and their eyes are occupied with the microscope, and they really don't want to have to look up every time you're passing them something. They will tend to do that with a new scrub or someone that they're not comfortable with, but for true efficiency, obviously you're going to want to get past that point. So when you're handing an instrument to the doctor, you are placing it in his hand, in his or her hand. Sorry. My husband said, you can't just say his all the time. I tend to do that. I don't know why. His or her hand in the orientation that they will use it, so they can immediately use it. They don't want to have to be turning it upside down or changing hands or flipping it around if it's backwards. So also some good technique would be to say, you know, open sharps. If you're passing a blade that's open, a disposable blade, you can do that, especially at first when the surgeon's not quite comfortable with passing with you yet. You can always say open sharp. And just be really consistent with the pressure that you're giving that instrument when you put it into his hand. So basically you want that grasping reflex to kick in so that it's an automatic exchange. So you put it in their hand and their hand closes around it because they feel the pressure. Okay. You want to also stay calm because sometimes things get a little crazy. Sometimes there's tension. Sometimes there's a lot of personalities that aren't calm. But your job is not to contribute to that stress. Your job is to stay calm no matter what. And don't be reactionary. So some of the things that you would naturally do, like, oh, my nose itches, I'm going to scratch, can't do that. Something's falling off the table, I'm going to grab it, don't do that. So always think before you act and keep yourself in a calm place. That's really important. Slightly compulsive, I think, is helpful. Well, I don't know how much to emphasize that because it can also be a handicap, particularly in a mission environment where there's a lot of adaptation and a certain amount of compromise that has to happen. And that's where I have struggled on trips before, but I think I'm getting there. And of course, being very careful. And the careful part is because you're dealing with sharps. You're dealing with potentially sharps that you are unfamiliar with in an environment where in certain countries, you know that there's a higher rate of HIV or Hep C. And we've had sharps exposures. There's not a good protocol in some places to get the patient tested. So then if you have an exposure and maybe it's kind of a waiting game. You know, you have to wait till you get home to get tested, then you have to wait a few months to get the all clear, and you just don't want to go through that. So be very careful with your sharps and avoid that exposure if you can. And the other reason to be careful too is I just might mention that ophthalmic instruments are fragile and they're expensive. So let's be careful with our equipment. Make it last as long as we can. Scrub Tech's motto is full bladder, empty stomach. If you actually scrub tech at home on a regular basis, you'll totally understand that's the truth of it. And it can feel like that too on these trips. So exercise integrity, make sure that if you contaminate something that you fix it or replace it, that you're always aware of that. And do the best you can with what you have. Okay.